Dr. Oz.
Mr. Vice President, I appreciate the leadership on this. There's no question that his commitment, the Vice President's commitment to rooting out this fraud is going to make a massive difference in preserving and protecting our nation's public health programs. It's going to protect patients. I want to thank President Trump for pushing all of us to make sure we protect our most vulnerable Americans, the ones that J.D. mentioned, the ones he grew up with, the ones all of us know in our lives. It also protects taxpayers from attacks on our healthcare system. Secretary Kennedy has spearheaded these efforts, and thanks to his leadership, I'm proud to announce the largest fraud initiative, anti-fraud effort of its kind in CMS history. Now, why is this action necessary? Last night in the State of the Union address, the President spoke about the affordability issues that we have improved dramatically in this administration. But let's put some numbers on health care. The average family puts about $27,000 into health care a year. They only pay $7,000 themselves, which is a lot, but there's an extra $20,000 invested for them. This is not a reasonable amount of money to spend. We have got to bend that curve downwards. It's unpredictable as well when you have to make these expenses, and the fraud that we're experiencing in America is making this already dangerous problem much worse. So we're going to fix these issues. The President last night spoke about the need for price transparency. That's going to help by making people more aware of what they're paying. It's also going to help us at CMS figure out what you should be paying and identifying fraud. To that note, the President announced last night that he's appointing our Vice President to lead the war on healthcare fraud, a wise choice. Your passion for this will make a huge difference. This is not about the money by itself. This is about people's lives and our culture, our shared values that have allowed these beautiful programs, Medicare and Medicaid, to survive brilliantly for 60 years. We believe, listen carefully, we are spending $300 billion a year in healthcare in this country for fraudulent, abusive, or wasteful purposes. $300 billion. Let's put that in perspective. If we could reduce fraud by 5%, which is at $300 billion, we would take the trust fund that's going to take care of all of us as we get older, and we would allow it not to expire in 5 to 6 years. We would double its life expectancy. That's massively important if you're going to trust the social safety net to be there for you. You deserve that social safety net. It's there. It's created. We're not going to let fraudsters steal it from you. The stellar CMS team, I want to call them out. Kim Brandt, who's videoing me over there, Dan Brillman, Capri Snap, Steph Carlton, have worked tirelessly to put this together. They've been rooting out criminals all year long. I know as well what it's like. I've visited all these areas, personally witnessed what it's like to see something you know is wrong and wonder why no one tried to fix it. It's infuriating. The Vice President described very accurately exactly what you see on the ground. These self-serving scoundrels, that's what they are, who rob our federal and state health programs, have decided it is worth the risk. I'm going to make a proposition to you. If you commit crime on Medicare or Medicaid in America and you steal, let's say, a couple $1 million, your jail sentence, first-time offender, maybe a year. For a lot of folks, that's a good deal. We have to take these crimes seriously and treat them as seriously as if they were bank robberies, because they're more dangerous than bank robberies. People get hurt during them.